Therapy is meant to support healing and personal growth, but when therapists cross ethical boundaries, it can become a tool for manipulation and control. Some therapists foster dependency, making clients feel they cannot function without their continued guidance. Others use emotional manipulation through guilt, fear, or gaslighting to maintain influence. Some exploit the client's vulnerability for personal gain, whether financial, professional, or sexual. Others build an idealized image of themselves as all-knowing authorities, discouraging any form of questioning. These tactics undermine the true purpose of therapy by replacing empowerment with dependence and clarity with confusion. When therapists encourage dependency, they subtly sabotage a client's ability to trust their own strength. Rather than promoting independence, they may keep treatment open-ended and vague, imply the client is incapable of functioning without them, or withhold empowering insights. The result is a dynamic where clients become emotionally reliant on the therapist, falsely believing that healing is only possible through continued sessions. Emotional manipulation is another common tactic. A therapist may use fear, guilt, or subtle forms of gaslighting to keep a client engaged. They might present themselves as the only source of insight or discourage clients from exploring other viewpoints. By rewriting a client's emotional reality to fit their own narrative, they create confusion and self-doubt, ultimately strengthening the client's dependence on them rather than guiding them towards self-trust and clarity. Exploiting a client's vulnerability for personal gain is a serious violation of trust. This can take the forms of pressuring clients into unnecessary sessions, or using personal stories for public content without consent, or even engaging in inappropriate sexual or romantic behavior under the guise of special connection. These actions not only deepen the client's original wounds, but also create new layers of trauma, making future healing more difficult. Another form of manipulation involves cultivating an idealized image of the therapist as infallible or uniquely enlightened. They may claim to have special knowledge or insight that sets them apart, subtly discouraging questions or alternative viewpoints. This creates a dynamic in which the client feels progress depends entirely on the therapist's guidance. Questioning becomes a form of betrayal, and independence feels like abandonment. In this way, the therapist positions themselves as the center of the client's emotional and psychological world, rather than helping the client become centered in themselves. These manipulative dynamics distort the fundamental purpose of therapy. Rather than helping clients reconnect with their own inner strength and clarity, unethical therapists keep them trapped in confusion, dependence, and emotional entanglement. Clients may leave therapy more disorientated and wounded than when they began. True healing requires honesty, boundaries, and a return to self-trust, something that's only possible when therapy is rooted in ethics, respect, and a genuine commitment to the client's freedom.